I just started. All right. So good morning, good afternoon, everyone. We're just waiting for all the attendees to join, and we're going to start shortly.
Good morning, and good afternoon, good evening to all. I'm going to go ahead and open this session and welcome everyone as people are starting to trickle in. But please join us in this celebration and launch of the evidence brief on meaningful youth engagement in a WHO guideline development process. This is a case study of the WHO abortion care guideline. I'm Dr. Karen Kim. I'm a medical officer with the Prevention of Unsafe Abortion Unit at headquarters, and the responsible technical officer for the abortion care guidelines. So this has been a true pleasure working with Ms. Helena, who will be showcasing the behind the scenes work that happened during the development process of the abortion care guideline. The evidence brief has just been released from its embargo. So you can see up on your screen the QR code and the details. So please peruse and enjoy. Just before diving into our welcome remarks, a couple housekeeping points. First and foremost is that interpretation is available in French and Spanish. You can see there is a globe with interpretation at the bottom of your screen, and then you can click into the desired language and just make sure to mute the English component. And then the other important point is please use the Q&A icon, which is also at the bottom to post your questions. And then I see already that people are posting where they're from in the chat, which we welcome, and please go ahead and do so. But for the questions, it'll be easier to have it all in one place, which is at the Q&A component. So with that, next slide, please. With just a quick snapshot of what we have entailed for the lineup is that we have our welcoming remarks, and then afterwards a presentation and overview of the evidence brief that was just launched and released. And then we dive into the fun components of the panel discussion with our fantastic panelists. So this is just a celebration discussion just to start off the many potential areas of work and projects in this space, that intersection between abortion care, comprehensive abortion care, and adolescents and youth. So, we just want to keep that conversation going. And with that, I'm happy to introduce our unit head, Dr. Bella Ganatra. And this is where I waited to say our department name because we are all part of the Department of Sexual, Reproductive, Maternal, Child, Adolescent Health, and Aging. And I will hand it over to Dr. Ganatra to welcome us. Thank you.
Thank you. Thank you very much, Karen. And on behalf of our department on the special program HRP and WHO, it is a great pleasure to welcome you to the launch of this case study about meaningful youth engagement and a description of the process that we followed during the making of the abortion care guideline. It's very important because, for one, in many settings, youth and adolescents face a disproportionate burden of the morbidity and mortality related to unsafe abortion. But it's also important for a much more positive reason because everywhere it is the young people that are driving the change, the innovation, especially as we see changes in service delivery for abortion care. And it's imperative that as we make guidelines and norms and standards, that the people who are central to this process are not excluded from it, nor are they included in a tokenistic way. The abortion care guideline took this very seriously. And at a time 4 years ago when this happened, when more formalized processes of engagement within WHO, like the Youth Council and others, did not exist. We believe that this case study that's launching today is very relevant, even in today's time, in driving both future guideline development efforts, but other efforts to make sure that young people are front and center of everything that we do in terms of abortion care. So welcome. And Karen, it's over to you to tell us more about the brief.
Thank you so much. And so we will dive into the overview of the evidence brief. You'll see here my name, which I've already introduced myself, but would love to introduce Dr. Michelina Treja, who is has been an essential component to this work. And so I will have it handed over to Dr. Michelina to take us through the first part of the evidence brief, and then I will finish it up with the components of the framework that was developed. Thank you.
Thank you so much, Karen, Dr. Kim, for introduction. And thank you so much, everyone, for joining this session. We are really, really excited and celebrating the efforts that have been ongoing over the last few years. And together today, we will be presenting a case study on how the meaningful youth engagement was integrated into the development of the 2022 abortion care guidelines. Dr. Ganatra already walked us through that introduction, but today we really want to show you the transformative approach. So rather than treating young people as occasional consultees or observers in a very tokenistic ways, WHO and its partners with this product really positioned youth as contributors, reviewers, and thought leaders throughout the guideline development process. And we want to show you, in this case, not only what you've contributed, but how their involvement strengthened the guidelines' relevance, equity, and real-world applicability. So it's an illustration of how very technical normative process that's traditionally dominated by adult experts can successfully include youth voices as equal partners. So to begin with, it's important to situate this work in the broader context. As Dr. Ganatra mentioned, this was done in a moment in which we really didn't have structures that exist now, which is, for instance, a WHO Youth Council and other mechanisms that have been introduced since then. So the background as well, globally, young people are disproportionately affected by unsafe abortion, and evidence shows that they face a unique constellation of barriers, including stigma, limited access to accurate information, concerns around confidentiality, restrictions related to age or third-party authorization. Yet historically, the youth perspectives and experiences have been missing from both the evidence-based and also in the policymaking and advocacy sphere. And this creates a misalignment between between the services young people need and what health system provide. So this process, including the WHO guideline development process, really seek to address the gap by combining the rigorous evidence with insight into the values, preferences, feasibility, and acceptability of services. So the background is very clear. We wanted to really develop a responsive and equitable global guidelines that highlighted the youth engagement that was not just optional, but it was really, really necessary. So before we proceed, it is important to clarify terminology. At the time when the youth engagement happened, there were efforts that many of our panelists actively took work with to create a global consensus statement on meaningful adolescent and youth engagement. And as many of the conflicts or misunderstanding usually start with different definitions, was important to acknowledge what does it actually mean, because there is a difference between participation and engagement, and equally between engagement and partnership. So what we also adopted as the working definition that was published in 2020 by the Partnership of Maternal, Newborn and Child Health, and multiple partners who endorsed that definition, is this definition that it is an inclusive, intentional, mutually respectful partnership between adolescent, youth, and adults, whereby power is shared, respective contributions are valued, and young people's ideas, perspectives, skills, and strengths are integrated into the design and delivery of programs, strategies, policies, funding mechanisms, and organizations that affect their lives and their communities, countries, and the world. So we have worked together with the PUA team and the instrumental organization to this work was the International Youth Alliance for Family Planning. And we adopted a 5 steps approach of the task force's work towards the abortion care guideline contributions. So starting with the Youth Task Force formation, as I mentioned, the International Youth Alliance for Family Planning, which is the organization that works with over 70 countries. The task force was created with 15 young leaders from all around the world. You can see on the map the representation of the task force members, and it was a youth-led structure, which means that it wasn't just that we have already several tasks to do. We were supposed to design what the appropriate intervention here would look like. So what the task force decided is that there would be 2 main activities that we want to undertake in order to address all the gaps and in order to be able to meaningfully contribute then to the questions that the WHO Guideline Development Group and the Evidence Review and Recommendation Groups would have. So big questions that you've had in this context was what are the barriers and challenges to accessing safe abortion care among adolescents and youth? And what are promising practices to facilitate access to safe abortion care among adolescents and youth? And big challenges that we have identified, we're looking at 5, which is provider bias, social, legal, and healthcare system barriers, the privacy and confidentiality, lack of access to appropriate health information, and overall umbrella, which is the abortion stigma in context of adolescent and youth. We were also looking at what are the promising practices to increase access to abortion care among youth and adolescents. And we can see that this is a response to the challenges that we identified. And we looked at 4 practices. We identified 4 practices. One is the youth-friendly health services. And we all know that the trick is in the definition. So what does the youth-friendly actually mean? Because there is a lot of evidence on it, but still the definitions might not be equally understood on what does that actually mean. The other would be dismantling the barriers and an abortion stigma. Finally, comprehensive sexuality education that we do know work not only for abortion care, but also for access to contraception and information for young people. And digital health interventions. And as you can see, that work was done in 2020 and 2022. So initially, we needed to really be very responsive to what is happening all around the world, because our work was literally done in the eye of a storm of a COVID pandemic. So it was very interesting to also see the emerging evidence and constant readiness to be able to update on what we are finding, because there were new evidence coming out. We also hosted virtual consultation in the countries that the task force members have been present. So we can see that 10 countries were selected: Mexico, Rwanda, Tanzania, Zambia, Bangladesh, Ivory Coast, Ghana, Benin, and Canada. And we were asking questions in 5 areas: so values and preferences, targeting barriers in abortion stigma, promising practices, and enabling environment to facilitate access to safe abortion. The 5th component was added on the go because we were in the middle of the pandemic, but that also really highlighted the transformation that we have seen in with regards to accessing digital health services and moving to online and telemedicine. So with regards to challenges, online consultations were really a great addition to what was found in the literature. With regards to challenges, abortion framed as something that only happens to irresponsible young people who don't use birth control correctly or who don't use more acceptable versions of birth control, as one of the participants from Canada mentions, and also the barriers that are very visible no matter which setting. So unnecessary requirements, medical tests, need for third-party authorization, need for consent form, which really keeps youth to keep it as secret, so they wouldn't like to go and access safe abortion because of that. And equally with promising practices, we found that, again, no matter which context, but the young people were pointing to the need for sexual education, like you see with the quote from Benin. For me to avoid unsafe abortions, one needs to have enough sexual education. It's important to implement education for young people to know their rights, contraceptive methods, and what to do with unintended pregnancy. Participants were mentioning the digital health, the need for digital health intervention. So we should have programs that focuses on technological interventions to reach more young people. It's a quote from a participant from Bangladesh, but also youth acknowledged the need of multifactorial approach. So youth-led, inclusive, multi-sectoral approach, meaning that it should involve government, local community leaders, healthcare, legislative, as well as private sector. So we can see that the two really went hand in hand. We also, to consolidate the findings from literature reviews and virtual consultation, we facilitated the technical meeting to allow a collaborative dialogue, ensuring the integration of those findings and looking at how we can use those findings to then put us to the last step, which is the contribution to WHO guidelines, because we ultimately wanted as well for the youth to be representatives at the evidence review and recommendation group and the guideline development group, which happens. And I would just hand it over now to Dr. Kim to talk us through on the actual process and our proposal of inclusion of the youth in a more sustainable way, learning from our case study. So, Dr. Kim, over to you.
Thank you. And so this is just a snapshot. I'm not going to go too deep into it, but the overall visual is that there is a multiple step process that goes into the guideline development process at WHO. And this is to ensure transparency, to minimize bias, and to really engage and involve the experts around the world. And so with this, and just keeping this in your mind's eye as we, before we go into the last slide, is that in these multiple steps, from beginning to end, in the preparations all the way to the dissemination, and in the in-between steps where the evidence was reviewed by these smaller groups called the Evidence and Recommendation Review Group, which Helena had just mentioned. And then ultimately, after the evidence has been reviewed and gone through the rigorous process of grade, and then the recommendations have to be formulated, take into account various aspects, not only with the published literature, but take into account the person-centeredness aspect, like acceptability, feasibility, the values and parentheses, and health equity. So multiple areas that go into and feed into the recommendations, which get reviewed by the guideline development group. So the GDG. So with that, we, in the next slide, we wanted to build in this this framework where you can see across the planning, development, publishing, and updating are the set overall phases that's in a WHO guideline process according to the guideline, the handbook for guideline development, which I call the guideline for guidelines. So in that handbook, it's put into these three phases. And so you see in the blue box, these are the steps required and what's entailed in each phase in a WHO guideline development. And then where we have provided examples are seen in the pink boxes at the bottom of where you can engage. And we, again, made a concerted effort to involve youth from beginning to the end. And this engagement is a continuation. It's not finite. And so we wanted to definitely give examples, but at the same time not be prescriptive and feel like you have to confine to this, but it's more of just showing visually that you can involve them from the very beginning, such as in the planning stages. This is where we had created the Youth for Abortion Task Force that Helena talked about, and really, set out to find out what are those key considerations to take into account in the discussions when going through the evidence. And then in the development stage, this is also an example that we provide is when we involved the youth in these meetings with the guideline development groups, the GDG, and then in the ERRG, which is the evidence review and recommendation group. So they were participants and were actively involved in the discussions when looking at the evidence and then factoring in the other important criteria, especially the considerations to human rights and how to respect and realize those rights. And then, of course, to me, this last step is where this definitely is not finite. The publishing and updating, after all that work and energy that was put into it, the dissemination and implementation are critical. And so having the involvement of those who were part of that process just really empowers them, but also bolsters that dissemination process, which is so important to getting the word out there that this is a guideline that should be used and should be that one-stop shop resource for comprehensive abortion care. And so this is just our a way of capturing of what has happened. Of course, we would love to have captured it more, and it would have been a book of all the various activities that surrounded it. But we definitely felt that this was a process to highlight, at the same time to use as an example for other guideline development groups, and also not to just confine it to youth and adolescents. There are so many different populations that should be, and part of the process when there's recommendations part of them. So we wanted to kind of give ideas and concrete examples to how you can bring in the youth or the other subgroups of, or end users that is really central to these recommendations. So with that, I think it's most important to leave time for our panelists and the discussions. So I'll hand it back to Helena to welcome and introduce our esteemed panelists. Thank you.
Thank you so much, Karen. And as it was mentioned, it was a little bit of a time machine that we took you with, and talked about things that happened back in 2020 and 2022, because also what really have been coming up, and I'm sure my fellow comrades in the youth front will also mention that many of the work that youth are doing or are involved with are not reported correctly or not being published in the way they should be or captured in the way they should be, because we do know that some of the youth might not have expertise enough to publish in scientific journals. So we thought that really publishing and capturing that snapshot, even though a long time has passed, would be helpful as well for people who are planning to engaging youth with the normative guidance. So here I want to have a lovely discussion with really youth comrades and veterans and graduates. Some of us are definitely, and have a conversation on how we can strengthen the work of meaningfully engaging. And I think that even talking about engagement at this stage might not be enough. I think that the word that we are using is more partnership, but I'm sure that we're going to have a discussion on this. So without further ado, I wanted to introduce my dear colleague Lucy, who is our first panelist. So Lucy is a public health doctor and long-standing youth SRHR advocate. She has led national, regional, global youth mobilization on issues such as comprehensive sexuality education, access to safe abortion care with a focus on new norms, movement building, countering anti-rights narratives, and advancing the youth-led accountability strategies. Lucy serves as the Senior Policy Officer and SRHR Lead for the United Nations Major Group for Children and Youth, and has extensive experience supporting a meaningful youth engagement across WHO, including being a member of the Youth Council, but also advisor to GAMA and WHO Quality of Care Metrics Technical Working Group. So fantastic to have you with us, Lucy. I wanted to kickstart with a first question to you, if that's okay. Could you share, as a member of all those different WHO and UN mechanisms, but in particularly WHO Youth Council, would you be able to share how the Council is working to meaningfully engage with youth and adolescents in the WHO's technical group, and what approaches or mechanisms have been the most effective so far? So over to you, Lucy.
Thanks so much, Misha. And also just I wanted to say congratulations on this piece of work. I think just like you said, we know there are examples of good practice, but all too often we don't actually write them up, we don't share them, and then we feel like we're reinventing the wheel again. And someone goes, you know what, I feel like a few years ago something like this was done, but no one can find out how it was done, and the learning on what worked, but also what didn't work doesn't get shared. So this is really so exciting to see. I think you asked me about the WHO Youth Council and, our involvement in terms of shaping youth engagement, particularly in technical work. And I think this is a really important question. For me, it goes to the heart of why the WHO Youth Council exists and why we wanted to get involved with it as MGCY. The Youth Council is a group of youth organizations, youth-led organizations, but it's not there to be just a sort of a consultation group, really. The whole point is to work with and across WHO to really institutionalize and strengthen the mechanisms for meaningful youth engagement and meaningful youth partnership across all elements of WHO's work. So that's kind of in deep system work. It's not easy, but I think, that's the aspiration, not just to provide one ad hoc way of engaging young people, but really to kind of change the mechanisms and the culture around youth engagement. And as part of that shift, where we've really tried to focus effort is moving kind of meaningful youth engagement from the margins, but also into the core of WHO's technical work, which is somewhere where young people are often not represented. And what that looks like in practice is really intentional. So that's about fostering, direct partnerships on technical work between WHO departments and youth-led organizations. Really trying to shape mechanisms of engagement that start from the beginning through to the end, recognizing that just engagement of one young person doesn't mean you're going to tap into all the views of young people and their diversity. So really trying to hit that message home. But also trying to facilitate and structure ways for young people to be involved in guideline development groups, in expert advisory groups, and in evidence review processes. So that really technical work where there's often been a very narrow view of what expertise is. And while we want to see youth engagement, it's all too easy to just say we've done a consultation with young people or we brought them in at the end to validate the exercise. And that's not what we want to see. We really want to see this as a process of collaboration that is co-shaped. And I think that's what's really exciting about some of the work that you've shared as well. One of the things that we've learned through this process, and I think many of us here will recognize this, is that, meaningful youth partnership only really becomes meaningful when it's supported. So a lot of what we're trying to do is creating, I guess, scaffolding's maybe the right word, scaffolding around it. So building young people's familiarity with technical processes. It's not that young people can't engage in the processes, but often they feel really opaque. You turn up in a room and there's lots of people who have 40 years experience under their belt. They know how this goes. And you think, what am I doing here? So really trying to demystify those processes. But also to support WHO teams to collaborate confidently with young people, to know what the capacity strengthening looks like, where to support, but also where to give space as well, so that, you're not there as someone different, you're not there as the kind of the youth advisor only, but you have meaningful contributions to make and you're given the space and the support to make those. And, I don't think I need to tell anyone here, but, the added value of engaging young people in technical work becomes apparent really quickly. Young people bring insights that don't always appear in published evidence, how stigma plays out, how legal restrictions shape the realities and experiences of care seeking. But also young people hold a lot of expertise that is not held elsewhere. So maybe you're a young healthcare professional, how your curriculum is changing, how service provision works and looks like for you, or you're doing, youth-led service delivery on ground. You know exactly, what the challenges are and where the opportunities are as well. So I think these contributions are really important in strengthening the rigor and the relevance of WHO's normative work. But also really trying to reframe what expertise looks like. So saying that, expertise is not just the 50 years experience and, academic titles, but actually expertise also sits in lived experience, and that is equally as powerful and equally important. So I think the Council's most effective approach has really been trying to embed young people, but also youth-led organizations and youth movements as contributors and as partners, not just sort of commentators, people who come in after the fact. And ultimately what we see is that makes guidance, it makes technical work far more grounded and rights responsive, which is really important.
Thanks so much, Lucy. What a comprehensive response. And this got me thinking that, you mentioned that it should be a direct partnership, not an afterthought, but really, in the planning phase, you should include community and youth engagement. And I think that this is what I'm particularly grateful to the WHO PUI team, because it wasn't an afterthought. It was really embedded in the entire process. And I think that that is why it was innovative. And I love what you said about expertise. I'm sure that Abdullah Nan is going to talk about on how it felt in the beginning, because there is a massive imposter syndrome. And many of the youth that were a part of the task forces, or even, with the youth spaces, it is that kind of, how can I contribute to those professors, and like, how can I be relevant? But you beautifully said about the importance of lived experience. So thanks so much for that. And I hope we're going to touch base on it throughout the panel. Just a quick reminder to everyone, because I see that people are posting their lovely questions in the Q&A. So feel free to continue do that. If you have a special question to any of the panelists or just a general one, we'll see how much time we have at the end to address them. So I want to move to David, Dr. David Imbago-Jacome, who is a medical doctor and global health professional with over a decade of experiences advancing sexual and reproductive health, gender equity, adolescent well-being. He currently serves as a manager for ecosystem development and equity at the Children Investment Fund Foundation, CIF. and is also a commissioner for the Lancet Commission on Adolescent Health and Well-being. And I was also, when I was reading the definition of the global consensus on meaningful youth engagement, I remember that you were, I think at the time, heading the adolescent and youth constituency at the PMNCH. So multiple different engagement. Definitely, we're gonna benefit from your wisdom. He also directed the Yield Hub and led global health programs with Core Group and Ecuador's Ministry of Public Health. Passionate about shifting power to young people, David works to build inclusive systems to put youth at the center. So, David, plethora of experience. You've been working in youth spaces for many years. Using your wisdom, what are the biggest challenges that the organizations face when trying to meaningfully engage with young people, and what gaps, if at all, you see most often? So, David, over to you.
Thank you so much, Michelina. And first of all, congrats. Congrats on this work. I'm super happy to see someone from the youth movement as well coming into WHO and championing this. I feel like it's the responsibility of those who, had those positions of privilege, making sure that wherever we are right now is academia, it is UN, it is through philanthropy in my case, we're still, opening those doors and making sure that we are championing and we are continuing with this journey. And it's great to know that we have each other, right? There's a community that has built from that space that is still active and is still thriving locally. So congrats to that. Congrats for the work. Congrats to WHO on this milestone. And thanks for the question. So on what I see the challenges, first, I think that it's important to acknowledge that the evidence is there. I feel that the recommendations are also there, are quite clear that meaningful youth engagement is a best buy, right? In global health, in SRHR, in climate. So there's no need to shortage frameworks, new checklists, new global definitions. I feel like we have reached that point where we are there. It's mostly about the challenge being putting this into practice, and that these changes and this practice might make some organizations uncomfortable in the process, right? Changing is not easy, and it can feel difficult at some point. So it's not, just about bringing young people to meetings or asking them for their opinions. It's actually shifting organizational culture, policies, and day-to-day practices. I'm sure that for most of us who have worked on this space, beyond getting buy-in from leadership, is also, getting the actual implementation with the admin team, with the legal staff, with the finances colleagues who are like, okay, what is this? Why are we doing this? Or challenging, what is the stipend? What that for? So I feel like the devil is in the details in this case. For example, what does it look like for us to actually compensate young people for their time? How do you handle a transition when the youth who you had involved in the programs turn 24, 30, 35, and you're like, okay, what does it mean? We were, like investing so much in this person, and that now they are no longer our youth representative in the spaces. So these are practical questions that go beyond what's written in global guidelines, and they require organizations to be flexible, to listen, and sometimes to challenge their own comfort zones. In my experience, the biggest barrier is actually the lack of will. Isn't the lack of will, but it's the reluctance to embrace this discomfort that comes with real challenge. I mean, we're so afraid of being canceled all the time, which I feel like is also, like actually backfiring on us. And that also is not allowing that change to happen naturally and organically, and saying that, yeah, meaningful youth engagement is such an subjective thing, is such a theoretical thing as well, which, yeah, there might be some mistakes in the process. And of course, there are values that we must uphold in whatever we do. But it's the moment for us to go from rhetoric to reality. And that takes courage, commitment, and willingness to get into a messy, practical process. Yeah. Thanks, Mija.
Thank you, David. And I think that you mentioned two things. One is on the reinventing the wheel. I think that was also yet another reason why we wanted to publish that work and look at the mechanisms that might be implemented and scaled up, because there's a lot of, I feel that it's a very buzzword to meaningfully engage youth. But as you said, devil is in the details and how to do it. What does that mean to engage meaningfully? And I'm really, happy that now you're thriving in a donor and philanthropy area as well, because this is also yet another thing that is very, very difficult to break. And I'm sure you can agree with me that not all of the donors are very much open on youth-led initiatives, and there's still the middlemen. So yeah, thank you so much for mentioning David and mentioning that, David, and for championing youth, being a youth emeritus in that space. I want to move to Abdulanan, who has been our youth for abortion task force member. He has also a plethora of experience to work with SRH organization in Ghana, including Mary Stopes and the International Youth Alliance for Family Planning. He served at the Youth Abortion Task Force, which is highlighted in our brief. And he's a medical doctor, and now he is waking up early because he's doing his PhD at the Arnold School of Public Health in University of South Carolina, when he's looking at the intersection between SRH and health equity. So, Abdulanan, let's go on the nostalgic route, coming back to years when we were working together at the Youth Abortion Task Force. What is the most memorable or impactful piece of work that you were involved in, and what made it stand out in terms of youth engagement, if at all? Very curious to hear, after all those years, what was really memorable to you. So over
Thank
to
you so Thank you so much, Miha. So I've been following the chat before I begin. I've seen so many young people joining from different countries. It's really beautiful to see so many young people in a room, and I feel the energy in the room over here. So back to the questions. For me, two things really stood out. The first was engaging young people through the focus group discussions in Ghana. I was honestly very moved because young people had so many thoughtful, practical insights on safe abortion. And I realized how many youth-led initiatives are happening quietly in our communities, and we don't even hear about them enough. We don't hear people talk about these initiatives enough. Young people are so passionate all over the globe, doing so many amazing things when it comes to, just increasing access to abortion, especially knowing how many disparities or how many inequities that exist when it comes to accessing safe abortion. And so for me, seeing that passion firsthand reminded me why meaningful youth engagement is not an optional tool. It's a resource we all need to utilize. And I'm so glad WHO is leading this front. I mean, the second memorable thing for me was when I read the evidence brief. I could literally see the voices of the young people that we had engaged throughout in this brief. I mean, it wasn't watered down, it wasn't reshaped, it was like duly respected. Because one of my experiences is that most of the time when young people are brought together to, bring their voices, at the end of the day, we do get like other so-called experts who would come and change everything and say, oh, we need to make this sound this way, we need to make it sound that way. But one thing about this evidence brief, when I was reading it, I was literally seeing some of the quotes from the engagement that I had personally, and it just felt like really authentic, not watered down, not reshaped. And for me, that was really one of the moments that I left with when it comes to, and that's why I believe in this document so much. And I was so glad when Lucy mentioned expertise when it comes to youth working with young people. I mean, the imposter syndrome, it's a real thing. I'm working with young people, when you do get a chance to get on a high technical like stage, there's always that feeling where you feel like, am I adequate enough? Can I really do this? Because all our lives we've been told that as young people we really can't do much, and we always feel like before you can really do anything you need to be older, you should have had a PhD, you should be highly educated. But I mean, for any young people listening out there, I don't think it's true. Of course, all the other things are important, getting an education and all of that, but your ideas are very valid. Young people are doing all of these amazing work. They have so many ideas, and we have seen all of this with all the work that we have done. Yeah. I mean, so yeah, just stop here. Thank
Thank
you.
you. And Abdullah, without you, the Ghanaian response wouldn't be so prominent. So thank you so much. Like, it's the online consultation that we hosted, and I still remember we first wanted to do that in person. We couldn't. We needed to move them online. So that was also living through the pandemic memory lane. But definitely and thank you for saying this, because that was always our goal is to make sure that we, how to create spaces for genuine voices. And I'm really glad we didn't we didn't talk about it before, but like thank you for mentioning this
I'm
because that
so glad
was
to.
the idea of it. Um, I also want to move back to David and just touch base a little bit on your work in the Lancet Commission on Adolescent Health and Well-being, because that is also yet another space in which I think that there were new recommendations that also touch base on meaningful youth engagement. So I wanted to maybe switch the gears a little bit, but on like how really both of those can be complementary. So how do these recommendations push the global agenda, and how does our evidence brief help in pushing the recommendations from the Lancet Commission? So
Yeah,
very curious to
for
hear about
sure.
it.
Thank you so much for the question, Michelina. I think that first of all, it's good to clarify that the commission also included meaningful youth engagement in the design. It wasn't by chance. It was at the heart of the commission, including young professionals who were feeding also into the agenda of the commission, but also into the outputs and how the research shape. Of course, in the end of the day is a research commission, right? So it's of course it's quite technical, quite high level, but I feel like at the same way, we also included, for example, through White Labs, a large cohort of adolescents feeding into what are the priorities for young people for the next decade, for example, right? So that was a great way to put it in practice. And when I say before that the evidence is clear, I feel like the Commission also did a very good job in capturing meaningful youth engagement as something that is, like is part of these best buys that I was saying before. So it's great to see that happening. Besides that, the Commission also makes recommendations, right? Which is for policymakers, for UN agencies, and it is explicitly mentioned that youth voices should be included in UN agencies, in governments, in NGOs, educational institutions, health services, and not just in areas that are typically linked to adolescent health, but across all the sectors, considering the multi-sectoral component of adolescent well-being, because it wasn't just a health commission, it was a well-being commission, and we know that well-being goes beyond health into education, security, safety, empowerment, economic stability, and so on. So that was great to see as part of the recommendations that were published. Then it also recommends establishing frameworks to ensure youth advisory boards are standard with clear mandates, resources, and accountabilities for acting on youth input. And you were talking about the youth council before, for example. So this is a great example of how, like there are, like I said, the devil is in the details, right? So beyond the creation of a advisory board, okay, what does it mean in terms of accountability, for example, right? Of course, the Commission also talks about the importance of youth organizations and how investing in them matters. And, coming from philanthropy, something that we also discuss constantly, but also how engaging young people in the designing and the implementation and monitoring of programs is important as well. Then there's also a clear ask from the Commission on the importance of remunerating young people for their contribution, recognizing their expertise and time, which is, is something that probably 20 years ago, there was, internship model. That was it. You had to be rich to be able to afford to go to Geneva for a WHO internship, and that was the case. And no one would challenge the drug. It is what it is. And now we have, made significant progress in making sure that we now have an equity lens into things and saying, okay, yes, we know that probably only global north organizations or, people with resources in their families are able to achieve this kind of landmark milestones in their careers, which is simply unfair. So the Commission also addresses this in terms of the equity and diversity, including making sure that we're also including engaging in an inclusive way with marginalized groups, younger adolescents, even in the work that we do, for example, in meaningful youth engagement in adolescents, we often engage with 18 to 24, 30, right? Which is, the easier group to engage with because we said, oh, parental consent is difficult, safety, safeguarding. It is difficult, yes. And like I said before, it will make us feel uncomfortable, but it's not impossible. So that's, for example, the Commission also calls for the engagement of younger adolescents, which we know it starts from the age of 10. So yeah, it's quite an interesting group for us to engage. Of course, I will not be speaking on behalf of a 12-year-old ever. I mean, there's a huge disconnection even within, our demographic group. So those are some of the things that the Commission recommends. How I see this pushing the global agenda. I think that for me, the main thing that the Commission recommends is calling for a post-SDG development goal that is centered around adolescent health and well-being, which includes youth engagement as a core metric. And I feel like the Commission suggesting a new global benchmark for adolescent well-being that includes youth engagement as the key metric. I feel like that is something, if we achieve that in 5 years, that will be a huge milestone for adolescent well-being and meaningful youth engagement. Yeah, thanks, Misha.
Thanks so much, David. So much of wisdom. I wanted to touch a little bit on what you mentioned of the differences between adolescent and youth, because it's also, we in our brief talked about youth engagement. So by no means, we're feeling that we are representing youth. And I think that there's also that kind of tick box exercise on like, oh yeah, we have a young person. And we can, generalize all the thoughts or all the findings to adolescents, and which we don't know. We know that it's not the case. We do know that also in context of, and I see that we have Dr. Sherry Bastian on the line in the context of the recent systematic review on the very, very young adolescents, like how much that group is different in comparison to youth. And I also have a feeling that when I was reading that report, the Lancet Commission a set of articles and recommendations, that there's definitely, we cannot just tick the box when we are engaging with youth that like, oh yes, that, because by proxy we can treat that this is the case. Whereas we do know that, and evidence is pointing us out that this group has a particular set of needs of its own. So looking at SRH now, because why, and coming to Lucy, because you also work clinically in sexual health on top of all the hats that you're wearing, but I'm curious to hear from you on why is it particularly important in context of SRH, in context of abortion, in context of contraception, and what value would young people's engagement bring to SRH policy and program design?
Yeah, absolutely. So I think, first off, I think we are probably a little bit ahead when it comes to sexual and reproductive health compared to other spaces. So I do want to give us a shout out, because sometimes I talk with colleagues working in areas like TB or, neglected tropical disease, and they're like, what space for young people? And I think we are a few steps ahead. But I think in SRHR, we do come through a rights-based approach. And I think, when we see the connection of the rights-based approach and the kind of the clinical evidence-based approach, we see some real magic happening. And, SRHR, people have already said kind of earlier on in this call, it's where, young people often face the most barriers. They are on the sharper side of exclusion, of stigma. And historically, they've often been one of the groups with the least influence over, policies and programs that are designed to supposedly meet their sexual and reproductive rights and their bodily autonomy. And that that feels like, okay, we're sort of redressing a historical inequality. But I think also in that conversation, we need to recognize the huge vibrancy and creativity and impact of the youth SRHR movement. And so actually kind of meaningful youth engagement in SRHR is not about creating a youth movement. It's about opening the door so the youth movement can step in and be heard and be present and have their voice really shaping evidence and policies and programs. So I think that's really important for me to start off with, because I think sometimes, there's a sense of this is really complicated. We have to create the mechanism and then we have to embed it. And actually, it's all out there. It is literally about starting the conversation. And like David said, it's often messy. But if you collaborate and you bring it, like those conversations start from the beginning, then, we all understand each other, right? We know these things don't never go to plan. We know there's complexity in systems. We know that, some places we have allies, some places we have people who are yet to learn. But actually, if we go on that journey together, then it's not a case of criticism. It's a case of how can we solve this ourselves, and how can we navigate together. When I think about the contribution that young people can make to technical work, it's about really moving from the abstract to the practical. Young people know where services break down. They know where stigma is showing up. But one of the things they can really add to guideline development work, for example, is not just what needs to be in the guideline, but also identifying where guidelines may be really well intentioned, but actually land poorly for adolescents and young people. And this also speaks to the reason why it's important to engage through youth-led organizations and youth in their diversity, because the issues that I might have in accessing my sexual and reproductive rights and being able to access services are going to be very different to another young person, a younger adolescent, a young migrant, a young person living in Benin. And so it's really important as well that when we structure these processes of engagement, that we don't, unintentionally create this mechanism where one young person is positioned as the voice for all of young people's lived realities. We need to recognize that, I think both that no one young person can represent that, even no one youth-led organization. But one of the things we're very good at is actually being able to think, how do we create and structure processes that allow more voices to come in? And it was great to see IYFP has been so involved, because they are really one of the youth organizations that I think have been at the forefront of opening up space and inviting diverse voices in. I think one of the other things that we really need to think about is why we're inviting young people into these conversations when it comes to SRHR. So it's not just about adding a youth perspective. It's not just about, saying we've ticked the box. And it is really about thinking about how we, young people can help bring their expertise, surface those blind spots, and make sure that our work is really responsive to the lived realities of those who are affected. So it's all very well to have a guideline that's developed in a global context in an ideal world, but really thinking about, how can we make sure that this is structured in a way that kind of meets people's lived realities, that doesn't reinforce unseen inequalities, and then thinking about, okay, what does implementation look like that? And one of the things I really wanted to say when we're in a conversation about guideline development is how we can think about involving young people and youth-led organizations in the monitoring and the implementation of these guidelines, to be able to tell us, are they working? Are they meeting our needs? How are they being used in practice? And then be able to kind of see this as a process of review and strengthening, because I think that's often where we kind of drop off at the end. And it's an area that young people are super passionate about. I think after you were talking about how, actually those conversations with young people on the ground was really powerful. You got to understand where some of those challenges were, what was working well. And I think we need to continue to build that into our kind of technical processes, rather than think, we've published a document and we're done.
Yeah.
So that's just what I wanted to share.
Thanks so much, Lucy. And oh, this is such a phenomenal discussion, really. I'm mindful of time, and I still would love to be able to answer the Q&A. But I wanted to just 30 seconds of like, what next? Like, I want to hear. I know it's a very challenging question, but what are your, let's say, one top recommendation for the way forward in strengthening meaningful youth engagement in WHO's technical work and global health more broadly? I'm going to start with Abdul Anan, because I'm mindful that we needed to move, but 30 seconds, and I'm counting because I know
Okay.
still
So
still.
my biggest takeaway
Yeah.
is that going forward, I think meaningful youth engagement becomes really stronger when young people are treated as partners and not just symbols. And when young people can always tell when they are just used for the optics, and when their voices actually mean something, that their voices or their inputs actually shift or move things. And so my biggest takeaway is that when young people really know that their work is being respected and it's doing the work that it's supposed to do, young people they truly bring out their best. And so for me, moving forward, we need structures that make youth participate not just in certain projects, but it should be built in how WHO engages across all departments, and creating that respectful and supportive spaces where young people feel safe and to make their contributions. It makes their contributions even richer. Yeah, I'm mindful of the time.
No,
Yeah,
thank you so
thank
much.
you.
Thanks. No,
Mhm.
this is definitely thanks for saying this, because it's something that's definitely crucial to move forward, that it's it's already institutionalized. So let's just use the experience.
Yeah.
Lucy?
Oh, 30 seconds. Okay. Institutionalize and resource youth engagement. So make it a process, make it standard. collaborate and create safe and enabling environments where young people can speak up as equal partners and contributors. And then move from just validation and consultation to co-designing. So co-designing research questions, co-designing methodologies, co-designing recommendations, and co-designing the follow-up and accountability process.
Wow, 30 seconds it is, Lucy. Thank you. And thanks for mentioning the co-design and co-creation, because this is definitely the next step that we have in mind for that work. So watch that space. David, final words of wisdom?
Thank you so much, Michalina. Keep doing this. I feel like that's my recommendation. Keep pushing, keep experimenting. This was this technical brief is a fantastic example of how an organization can experiment, be flexible, and ultimately create something truly impactful. The world looks up to WHO as a role model, so it's encouraging to see WHO stepping up as a thought leader and as a normative agency. And I think that you are reshaping how evidence is generating by putting people with lived experience at the center. So congrats to that and keep doing it.
Thank you so much. And thanks for such an amazing panel. It feels like we can, just grab a coffee and have a conversations. And it's just that I know that we all work together. I see that in the chat, there is also Stephen, who has been our youth abortion task force member. Hi, Stephen, who did amazing work in Zambia. So I am now putting over. Thank you so much again. I'm handing over to Karen for the final words before we end on a Swiss time. Thank you.
Thank you so much. I mean, I wish I could teletransport everyone here, just because you see we have a big, nice space, and there's definitely room for many more discussions, but this is just the start. As I said in the beginning, that there's many things in the pipeline. And so we are inviting those to join us and continue these conversations. So we wanted to, there's many people behind the scenes involved and putting effort both into the brief and this webinar and the launch. So apologies that this is quick and not exhaustive, but we definitely want to thank those members for our Youth for Abortion Task Force. And then those who have contributed and in the feedback through the external review group for the brief. And then, of course, there were multiple consultations, in-person consultations. So there have been many players. And then additionally, many thanks to our interpreters, our interpretation team, and to the IT, our publications team. And there's so much support and fantastic work to make this webinar and launch a success. So huge thanks to them. And we're ending with this slide here, just to invite you to join this community of practice on comprehensive abortion care. This is a simple way to stay connected with others in comprehensive abortion care, share resources, research opportunities. This is where we would post and invite you all to join, or if there's additional projects or input needed and consultations, this is where we would definitely post and make it and disseminate. So please keep your eyes on the space and join if you're not already a member. This is the COP is hosted by IBP Network and at WHO and HRP, our special programs in research. So it's actually one of 20 COPs that we have and that we host. So please, I also have seen some questions in the chat of how to join other groups. So I also invite Abdul and Lucy for just putting in additional links to how they can join the networks, the multiple youth networks. And with that, I also wanted to just say that, again, it was opportunistic that we had this engagement and collaboration with the International Youth for Association for Family Planning, IYFP. And then after, because this guideline process was so long, and afterwards we had the WHO Youth Council, and there's just been an opening of the various youth networks that are out there. And these are very much in our eyesight to engage and continue these great conversations, because there's a lot of work ahead of us. And even though we ourselves are not youth, we are representative, and we once were the teens and young people, and we continue to engage them as we grow old together. So with that, thank you for joining us, and we'll be sharing and circulating the materials afterwards once they're prepared. So thank you, and have a good rest of the day.
Thank you so much.
Thank you.
Thank you.
Thank you, guys.
Thank you.
Thank you. Thank you, Lucy and Abdul and David. Oh, they left. We'll write a thank you note. Good job.
So we're gonna hop off, and I'm gonna stop
Yes.
recording.
Yes.